It's time for Morton in the Morning on WVBF, a weekly get-together with your friends at Morton Hospital. Coming to you every Wednesday at 11:05 a.m., Morton in the Morning brings you full access to the latest hospital news and health information. Stay in the know about important health and wellness topics, new doctors and services, and upcoming events. And get to know the team at your community hospital. And now, Morton in the Morning.
Good morning, everyone, and welcome to this week's episode of Morton in the Morning. I'm your host, Julie, and we are broadcasting right here from Morton Hospital, your community hospital in Taunton. Thank you so much for joining us. We are very excited. We have a great show for you today. We are going to be giving an update on our MORCAP Substance Use Disorder Treatment Unit here at the hospital that opened back in November. And we have actually 3 guests joining us today, so you're not going to be hearing many updates from me because our show is jam-packed with great information and updates from our team. So let's jump right in and hear from our team at our MORCAP unit. So we're very excited to have 2 special guests today. They are from our MORCAP unit. We have Dr. Patricia de Lima and Justin Black, who are part of the leadership team of the unit. So thank you both for being here.
Thank you for having us.
All right, so I want to hear about yourselves. Tell me about yourself and your role here at Morton Hospital. So maybe Dr. de Lima, would you like to start?
Sure. Thank you, Julie, for having us. I'm Patricia de Lima, and I am the medical director of Morton Hospital's Comprehensive Addiction Program, as Julie mentioned, MORCAP. I am an internal medicine trained physician who then followed that up with a fellowship in addiction medicine, and I'm also now board certified in addiction medicine. I trained in New York, and I recently graduated in 2021, after which I had the pleasure of coming and joining the Morton team and opening our level 4 inpatient detox, as well as a few of the other components of MORCAP, which I'm sure we'll get into.
Awesome. So what intrigued you about coming to Morton?
For me, it's about treating an underserved community.
Mm-hmm.
For me, that's the most valuable part of my job. I feel that here at Taunton, there are many persons in the community who need this service who do not have access to it, given that the nearest detox is well a ways from here, meaning that patients would have to leave their home, leave the comfort of their community, as well as the support system that they have. So that was one of the most appealing aspects of me joining the team, as well as the fact that it's a new unit. So with that, comes a responsibility to be able to design the unit to the best of my evidence-based capacity, and those were part of the reasons why I joined.
Excellent. Well, we are very happy and fortunate to have you here to lead the program. And Justin, tell us about yourself.
Yes, so my name is Justin Black. I'm the Administrative Director of Behavioral Health, so I oversee the operations for not only the MORCAP unit, but also the EBHS, our elder behavioral unit as well. I've been in behavioral health for over 10 years in many different capacities, from starting as an MHA, mental health associate, to working as a clinical group leader at a forensic hospital in Massachusetts. And then I've also worked here in the capacity of the manager of patient relations and behavioral health quality.
Excellent. Well, again, thank you both for being here. Now, Dr. de Lima, I know that you said that you had started off in internal medicine. What got you into the field of addiction medicine?
Yeah, so when I was growing up, I was always intrigued by this addiction disease and seeing how people were being treated like less than, being stigmatized, and being pretty much ostracized for having what is essentially a chronic medical condition. So I did my training in the Bronx, and I had the opportunity to see how addiction was really devastating that community. And in my training at the hospital I was at, which was really a great experience, I was able to learn the complexity of the disease, is learning that, that it is a chronic condition, and just managing also the comorbidities seemed like the perfect role for me to specialize in addiction, to be able to elevate the care that's provided, as well as destigmatize this condition that is similar to diabetes. And patients need medications for diabetes just like they need medications or may need medications for their addiction. What we see is that internists, we are capable and licensed to treat addictions. However, given that it's not really in the medical school curriculum, it now is. There have been some changes in recent years due to this vast need and the overarching opioid epidemic that we've seen since, the 1990s and is only on the rise. Now we have the opportunity to specialize in the field and educate not only patients but also colleagues alike, fellow physicians, social workers, nurses, case management, and that's why I decided to pursue this addiction fellowship.
Okay. And how new is addiction medicine as a specialty? Has that always been around, or did that really just branch out recently?
That's a great question. So historically, addiction has been treated by psychiatrists in the field of addiction psychiatry, which is obviously a subspecialty of the psychiatry residency. There was a few years ago, I want to say 10-15 years ago, an interest for internists to join this field, because we do see that there isn't only a psychiatric component to the disease, but also many medical components to it and complications of addiction that come with addiction itself that, sometimes psychiatrists are not trained to treat. So initially there was something, and there still is something called the fifth pathway career, by which internists who meet certain amount of hours in addiction setting that has to be documented and has to be really tracked throughout the career, they became eligible to sit for the addiction medicine board, which was imparted by it was imparted by the American Board of Preventative Medicine. After about, I want to say, 6 years of that being available, we started to see that there is a need for specialists for a specialty in general, for physicians to train in a highly specialized setting, and then from their fellowship go on to specialize in the field. Currently, we still have both pathways. However, we're slowly leaning or going towards undoing or getting rid of the fifth pathway branch, so that all physicians who are in addiction medicine get there through a qualified addiction fellowship.
Okay. Well, you are certainly the first addiction medicine specialist we've ever had here at Morton, so thank you for being part of our team.
Thank you.
Justin, you were talking a little bit about your background in behavioral health. How has that benefited you, transitioning into this role?
I think it's actually helped a lot. Working in the prison system originally as a counselor or a clinician, I was able to kind of own and become the lead addiction counselor.
Okay.
So we focus a lot on smart recovery. We focus a lot on AA, NA, and it was really an easy transition to the unit because I had all the principles already learned from before.
Okay.
And then also there are a lot of the dual diagnosis behavioral health aspects, because a lot of patients that do come up to the unit, they may have some underlying behavioral health diagnosis such as schizophrenia, bipolar, personality disorders. So I think being able to put my knowledge of the past work into a management role, it helps meet the nurses, the patients, and just overall the staff that works with them where they are.
Great. Well, once again, we are so happy to have you both here today to talk all about our MORCAP unit. During the show today, we are going to learn about the specific types of treatments that are offered here on both our inpatient side and our outpatient program. We're going to learn about patient eligibility and much, much more. So please stay with us and stay tuned into today's show. Before we dive into more info about MORCAP, it's just about time to take our first break, and we want to remind our listeners how you can contact us at Morton in the Morning. You can send us an email at any time at mortoninthemorning@steward.org. That's MORTON in the morning at STEWARD.org. We would love to hear your feedback about our shows and any suggestions you have for future shows, guests that you'd like to hear from, or any types of health and wellness topics that you'd like to hear about. So, again, today we are talking about our MORCAP unit. Our guests are Dr. Patricia de Lima and Justin Black, who are part of the leadership team here in the hospital for our MORCAP unit. And we will be right back after this first short break of today's show.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
From all of us at Morton Hospital, thank you to our community for voting for us in the 2021 Best of the Best Community Choice Awards. We're honored to have been voted Best Hospital, Best Audiologist, Best Hearing Aid Center, Best Physical Therapy, and Best Weight Loss Center in the Metro South region. Learn more about our services and quality achievements at mortonhospital.org and follow us on Facebook to stay up to date on what's happening at your award-winning community hospital.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning, everyone, and welcome to Morton in the Morning. If you are just tuning in, we have a couple of special guests with us here today, and they are here to give an update on our MORCAP Substance Use Disorder Treatment Unit. We have Dr. Patricia de Lima, who is the medical director, and Justin Black, who is the administrative director. So we just learned a bit about both of them, and now we want to learn all about our unit. Okay, so let's talk about MORCAP, because it's been several months now since we've been open, and Dr. de Lima, you had mentioned that prior to this there weren't many similar resources. Actually, we were the first level 4 unit to open in Southeastern Mass. So tell us about MORCAP. Like, what are the services that we offer here?
Yeah, definitely. So MORCAP currently has what I like to consider 2 branches. There's the inpatient side and the outpatient side. On the inpatient side, we offer what is acute detoxification services. This basically encompasses what is the management of patients who are either acutely intoxicated and impending a withdrawal syndrome that could potentially harm their life. Mm-hmm. And these are things like the benzodiazepines, alcohol withdrawal that are life-threatening in the withdrawal period, as well as opioid withdrawal syndrome. Simply, opioid withdrawal syndrome will not lead to death, but however, it is very uncomfortable, and it is a crucial point to capture patients. We want to capture the patients that are suffering from opioid withdrawal syndrome, because we can get them treated. We can get them started on medications for their actual opioid use disorder, which is the underlying disease by which the withdrawal ensues. Mm-hmm. So that's what we do on the inpatient side. We manage the withdrawal with medications. We have 24/7 provider coverage here, which is done by myself, or we have nurse practitioners, we have physician assistants who also assist in the treatment of these patients. Mm-hmm. While they're here, we not only treat their withdrawal syndrome, but also any medical complication they might be experiencing from the same. Things like diabetes, hypertension. Mm-hmm. We have a lot of patients who, for example, are suffering from opioid use disorder complicated by injection drug use. So we're talking about cellulitis, endocarditis, hepatitis C. We run labs, we treat communicable infectious diseases, which therefore decreases the public health risk, not only for the patients themselves, but also just for the public in general, as these are transmissible through various routes. We do a lot of teaching, a lot of educating, a lot of especially destigmatizing. While the patients are admitted at MORCAP, they are seen by a counselor daily on a one-to-one basis for a very personal and individualized treatment plan. There's also counseling groups that are ongoing throughout the entire day, essentially, from, I believe, 8:30 a.m. after breakfast until, about 8:30 p.m. or 9 p.m. There's different groups that tailor to, the use of naloxone, which is known as Narcan, the brand name, which is a life-saving opioid reversal agent that is, readily accessible and will literally bring somebody back from dying if they have incurred an opioid overdose. Mm-hmm. We talk about, safe sexual practices. That's when, persons are under the influence of X substance, whichever that may be. A lot of times, the inhibitions are not there, and we want to encourage patients to practice safely. Apart from that, we really just provide some psychosocial supports, and a lot of times, I want to say probably 80% of the time, persons who have an addiction have an underlying psychological psychiatric disorder, things like post-traumatic stress disorder, anxiety, depression. Especially with COVID, in recent times, we've seen a lot of our patients who were formerly stable within their condition, because again, it is a chronic condition, who may have been stable. We see that with COVID, with the isolation and the anxiety, depression, a lot of patients have relapsed and needed a lot more support. So that's what we provide on the inpatient side. Yep. We start medications for their underlying condition. We have medications for alcohol use disorder, not just for the withdrawal, but for the actual disease. Medications that decrease cravings for alcohol, things like a camprosate or naltrexone. We also start methadone for patients that are suffering from opioid use disorder, as well as Suboxone, which is buprenorphine, another treatment option for patients with opioid use disorder. And one of the key things that we do, and one of the most important things that we do, is that we link these patients for ongoing treatment. The initial inpatient stay is simply that. It's the acute complication of their disease. Once we stabilize that acuity, we have to continue to tackle the underlying chronic condition. So we are able to link patients to further treatment, whether that be an inpatient rehabilitation service or clinical stabilization services that are more of a 2-week program. We have transitional stabilization services that are actually state funded and can run anywhere up to 6 months. Patients sometimes opt for sober living homes, or a lot of them just want outpatient ongoing, visits with an addiction specialist. So that brings me to our outpatient branch. As I said, MORCAP has inpatient and it has outpatient. So in the outpatient side of things, we offer 2 branches here. We have the IOP, which is the intensive outpatient program, and hopefully most of you heard the wonderful talk with Thomas Rumbell, who is our lead clinician of the IOP. There, it's a very intensive counseling that happens 3 days a week for 3 hours each session. We offer 2. One is in the morning and one is in the evening, and this is to better accommodate those persons who work, who have kids or who have social obligations that cannot be met by one or the other session. That is typically the program really is guided by Tom, and it depends. Their course depends. Could be anywhere from 3 weeks, 6 weeks, also depending on the insurance, how much time is there. So that is the strictly counseling. It's done in a group session because we've learned something, that the power of identification is very, very, very strong, very important in persons suffering with addiction, because a lot of times patients tend to think like they're alone, or like there's a lot of shame associated with this disease, and simply being in a room with people who are suffering from the same and overcoming it together is quite powerful. The other branch we have is the MAT clinic, which stands for Medications for Addiction Treatment. This is for patients who were either started on a medication for their addiction, as I mentioned, a few of them, a camprosate, and naltrexone, or methadone, or Suboxone. We can continue these except for the methadone. That's done at a federal opioid treatment program, but we do start them at MORCAP inpatient and link them to an OTP, the opioid treatment program. But for those patients who work or who simply do not feel that the intensive outpatient program is for them, we have a clinic where we can continue their medication, monitor for any potential side effects. We do urine drug screen sporadically, just to make sure that, one, the patient is safely taking their medication, to monitor their improvement and where they're at in their treatment, and also so that we as providers can ensure that we're not causing harm by providing a medication that perhaps they're not using. So this is pretty much what MORCAP has to offer at present.
That's a lot. Thank you. That was a really extensive overview. Sounds like we're offering some really essential services for the community. And you mentioned Tom, so yes, we will have Tom on for the second part of the show after this interview to give a little bit more detail about the IOP, or the Intensive Outpatient Program. So, so many services being offered. Let's talk about the people that are involved. So obviously both of you are part of the leadership team. Dr. de Lima, you mentioned there are providers. There's Tom, who runs the outpatient program. Who else is part of the unit, running the unit and caring for patients?
Yeah, so we're very unique in a hospital setting because a lot of the detoxes, they're kind of set away from a clinical setting, and they're kind of freestanding, where we actually were obviously part of Morton, and we have a plethora of different resources for this patients. We have, of course, nurses that are on to help the patients with their medications and their one-on-one therapies when needed. We also have mental health associates who kind of monitor patient safety checks. They're kind of the eyes and ears of the unit. They're very important to keeping the milieu nice and peaceful, making sure the patients get their meals, get their toiletries, and really they are kind of the boots on the ground, and they're really taking care of the patients on a molecular day-to-day basis. And then we have counselors. We have counselors who are helping with aftercare, long-term treatment, getting them to their next appointments, helping out with their last dose for methadones. So they're the glue that puts the whole thing together. Okay. They work very closely with Dr. de Lima. We have one of our lead counselors, Beth. She runs the team for us. She's amazing. As is most of the councils and all the councils that we do have, but she's one that really she is taking the reins. Sure. We also have a clinical manager, Deirdre, who does a great job of overseeing our intake and evaluation area, and that's really maybe where I should have started, because that's where the process starts. So as soon as you come and you want to seek treatment here at MORCAP, you call our number for the intake department. You speak with an intake clinician. And then at that point, you're deemed either eligible as a 3.7 or 4.0. And of course, we're striving for the more 4.0s is better, because we are a 4.0 medical detox unit. But we do accept other insurances for 3.7s to get those patients in there as well. Okay. And at that point, after the intake goes through and they are able to come in, they're looked at by our evaluation clinicians. That are, they see them, they take their psych socials, and then they move them over to our nurse practitioner, who's a PA, whoever the admitting provider, or if it's Dr. de Lima. So we do have a very tight-knit crew up there. We have a lot of different departments that are working as one and trying to get everything going together.
A lot of people out there. Now, are you currently looking to hire more people for the unit? Do you have any open positions?
We do, yes. We are looking for nurses on the overnights in particular. We've had a couple recruits lately come in for the overnights, 2 or 3 that have come on. So we're doing very well with the recruitment process, because as soon as we get more nurses in, we're able to bump our census up. We're a 32-bed unit. Right now we're functioning at 20 beds. We just recently went up from 18. The next step would be 24, and it's really dependent on our staffing. So we're really hoping to get some nurses that are eager and willing to work with us in this new unit, and then hopefully we can get to the highest point.
Okay, yeah, I was going to ask you how the unit has grown, because I know that we officially opened back in November. So it sounds like we have capacity for 32. Right now we're at 20, and we're working toward that 32. And obviously the number of staff has grown significantly since the beginning as well.
Yeah, and to highlight that growth, we actually, like Justin highlighted, have a 32-bed unit, and we're limited by our staffing needs. We do want to make sure our patients are safe and being provided the utmost quality care. But we started November with 6 patients, with a limit of 6 patients, and that just shows to the leadership team here, the hiring process of how we've been able to grow to 20 in just a matter of 6 to 7 months. So we're also looking to hire any nurse practitioner or physician assistant that might be interested in treating this underserved population. We're looking for people who are compassionate, for people who have a desire to provide care to this very suffering population.
Okay. Great. So opportunities out there for anyone who's listening. If you want to grow it, to join a growing unit, very exciting opportunity. So, check out the jobs on our jobs page, jobs.steward.org, or contact our Human Resources Department. We are always looking for great candidates to join our team and specifically to join this unit with Dr. de Lima and Justin. Now, a lot more content to come. We are not quite done with Dr. de Lima and Justin, and then after that we have Tom from the MORCAP Outpatient program to tell us more about that, but it is time for us to take another break. So please stay with us. We're hearing all about our MORCAP unit at Morton Hospital today, and we have a lot of great content to come. We'll be right back after this short message.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
Morton Hospital's nationally accredited Center for Weight Control has grown with the addition of Dr. Deepthi De Silva, our new Director of Medical Weight Loss Management. Our center now offers high-quality medical and surgical weight loss options close to home, with medical weight loss appointments now available in Taunton and Middleborough. To learn if you qualify for weight loss surgery or medical weight loss and to schedule a consultation, call our Center for Weight Control at 508-301-2434.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning and welcome back to the second half of today's Morton in the Morning show. Today we are here with Dr. Patricia de Lima, our medical director for our MORCAP unit, and Justin Black, who is the administrative director, and we've been hearing all about the unit, treatments offered, and before we took a break we were talking a little bit about patient eligibility to be part of the unit or to be treated on the inpatient side. Now I want to bounce back just briefly to something that you said, Justin. You were talking about a little bit about eligibility and how some patients are considered 3 point something versus 4 point something. Obviously, we're a level 4. So what qualifies someone to be a level 4?
Yeah, I'll go ahead and answer that question. This is something that we use to really, like an emergency room does triage of their patients. For example, if you're going into the emergency room and you're having chest pain, you're going to be seen before the patient who's coming in, perhaps with a stub toe or abdominal pain, which can also be an emergency. But if you're having chest pain, you're likely to be seen just because of the acuity and the potential harms to your life in that setting. So with the 3.7 and the 4.0, with the American Society of Addiction Medicine, ASAM, which is basically the leading society in addiction medicine, what they targeted in doing, or what they were looking to do in dividing the spectrum of addiction into levels, and the levels start at 1.0. This is an outpatient. There's level 2, there's 2.1, there's 3, 3.1, 3.5, 3.7, and 4.0. This is obviously a conversation that can go on for a long time, but here we'll focus on the 3.7 and the 4.0. These are considered inpatient withdrawal needs of patients with addiction. So essentially, if you're using a substance and you want to stop and you're going to go through a withdrawal, you might qualify to have your withdrawal managed as an inpatient. Now, to differentiate between the two, persons who are suffering with just opioid use disorder, and I say just lightly because it's not just, it's a very severe disease, but like I mentioned earlier, it's not life-threatening. If a patient's coming in with opioid use disorder complicated by withdrawal, and for example, let's say it's an otherwise healthy 25-year-old male who's coming in, he wants to stop using, doesn't have the hypertension, doesn't have diabetes, perhaps this patient is not injecting, doesn't have, a cellulitis, which is a soft tissue infection from their injection. This patient would be considered a pretty stable, lower risk patient, and that's what we would consider a 3.7.
Okay.
The 4.0 would be the patient who perhaps is the 64-year-old or even the 38-year-old male or female who is coming in with a severe alcohol use disorder complicated by withdrawal syndrome. or benzodiazepine or any sedative medication. Persons who are suffering with these conditions are at risk of death from their withdrawal. They can, and prior to the death, they can experience seizures, confusion, delirium, what was formerly called DTs or delirium tremens, which is simply a complicated alcohol withdrawal syndrome that we see happens within days 1 and 2 from abstinence. These patients who really require that 24-hour, and regardless of what level you are, you're still going to have the 24-hour nursing. You're still going to have access to the MD daily. There will be always a nurse practitioner or a physician on 24/7. However, it's just to really triage and highlight that the 4.0 patients are perhaps those that require, an intravenous access for example, maybe fluids, or for lorazepam, which is a benzodiazepine that we use to treat alcohol withdrawal syndrome, one of many. These patients are considered a 4.0, and it's really just to, it's on a spectrum. Patients will move from 3.7 to 4, vice versa. They'll go to a level 1. Our intensive outpatient program, for example, is a level 1, or on that 1 spectrum. The higher the number, the higher the acuity, and the higher the risk of complications from the condition.
Okay. And patients can self-refer by calling the unit, and you could screen them to determine if they're eligible?
Yes, yep. They can go to the emergency room. They can self-refer. They can. We've been reaching out to doctors' offices around the area as well to make sure that we're trying to catch as many from the community as possible, because at the end of the day, the reason MORCAP was opened up was to serve this community.
Okay.
And that's also something I want to highlight is huge. That what we're doing by opening up the venue, the avenues of admission, is that we're really making it accessible. Mm-hmm. What we see across not just Massachusetts, but I like I said, I train in New York, is that a lot of times patients can't self-refer. They have to come in through an emergency room. Mm-hmm. And that really limits things, because a person who's suffering from addiction a lot of times will feel stigmatized, and the last thing they want to do is sometimes go to an emergency room where they might feel like they're going to be overlooked, or they're going to be, not to say that doesn't happen all over the world, but we're just really trying to decrease the barrier to a point where the patient can potentially bypass the whole emergency room wait, and the chaos. As we know, currently our emergency rooms are overloaded, overwhelmed. We're also trying to facilitate the flow of our emergency staff and not overloading them with patients that we can really just see up on our unit. So we'll screen them up there, like Justin said. The intake coordinator will take an initial assessment. There's a questionnaire just to find out what substance a person's been using, for how long, what kind of complications they've had, if any, from their use, what medical conditions they have, what medications they're on, and then that intake coordinator will hand over that screening sheet to the nurse practitioner or myself, and we will say, this patient could potentially meets criteria based on what I'm seeing here. Okay. So then the patient, that intake coordinator will call the patient back and let them know, seems like right now you could potentially meet criteria. We have a bed. Let's get you in here at, let's say, 2 o'clock, or what time works for you. We're very flexible. We want you to come, so we'll work with you. Then the patient will come in and be seen by the evaluator, who does a complete biopsychosocial assessment. After that is complete, the nurse practitioner will see the patient. And a caveat is that the patient, just from coming in, it's an assessment. It doesn't mean that you will be admitted. Mm-hmm. Things do come up sometimes. Perhaps the person might be too intoxicated, and at that point we like to send the patient down to the emergency room, just because we feel it's safer. Mm-hmm. Let's get a set of labs. Let's wait until they're clinically improved and can speak to us and understand the rules, the guidelines, and the protocols that we have on our unit, just because we don't want anybody to come in who doesn't fully understand what it means to come to the unit. It's not just like if you are suffering from this disease and you've been in the hospital, for example, on a medical floor for withdrawal treatment. It's very different than what we do at MORCAP. We have groups, and we like our patients to go to group as soon as they're clinically able to. Mm-hmm. Days 1 and 2 can be rough for a lot of patients, maybe even days 3 and 4, and obviously we tailor the care to that. The nurses can excuse the patient from groups if they're not feeling well, but we do want to make sure that our patients are able to participate in the treatment milieu. So that's something that's important to to highlight.
Okay, great. Well, so much great information shared. We have about 1 minute left in our show today. So one final question for whoever wants to take it. What is your ultimate goal for your patients?
So the ultimate goal is we want to aid them into sobriety. We want to make sure that if they're seeking out help, that they get that help in the community with us, and it stops right there. So they can look to us as a resource. They can, use us as a launching point to a lifelong recovery. Whether it is with our IOP, whether it's with our MAT clinic, whether it's with another long-term treatment facility. But our goal is to ultimately, help them out in a part of their life where they're seeking the most help.
Excellent. And now we have this great resource here. So I want to thank you both very much for the important work that you're doing, the whole team up at MORCAP. And to our listeners out there, please reach out if you or anyone you know needs some help. Call our unit. The number is 508-967-3200, and they can direct you accordingly. So Dr. de Lima, Justin, thank you so much. We appreciate you being here.
Thank you.
Thank you, Julie.
So our second guest today is Tom Rumbell. He is the lead IOP clinician, which stands for Intensive Outpatient Program, for our MORCAP program. So Tom, thanks so much for being here.
Thank you.
We're excited to learn a little bit about the outpatient components of the program, but first tell us a bit about yourself.
So I grew up in the area. I've been working in the healthcare field for over 20 years. I've been with the Stewart's medical system for over 20 years.
Wow.
We recently just moved here to the Morton Hospital, where we're doing an outpatient program to help people in the community address their substance abuse and perhaps even mental health issues.
Awesome. Yeah, and I know our MORCAP program has, we officially opened in November of 2021, but the outpatient program, when did that actually get up and running?
Same time.
Same time. Okay. I wasn't sure if it was a couple months later or okay, great. So how did you get into the field of addiction medicine?
So I started working with people when I was very young, around 17, 18 years old. I've worked with kids. I worked with people with challenges developmentally.
Okay.
In my teens, in my early 20s. Went to school to work in the field. I got my master's in clinical psychology.
Nice.
So I pretty much stayed on track with that. And then I worked in different psychiatric hospitals and other facilities and do consulting work. And I've been mainly with the Stewart Good Samaritans. Stewart Good Samaritans is where I started.
Yep.
And now I'm with the Morton healthcare system.
Okay, great. It sounds like you definitely have just a general passion for helping people.
Correct.
All right. So tell us about the IOP program.
So the IOP program, IOP stands for Intense Outpatient. It is a Monday, Wednesday, Friday program. It runs a 4 to 6 week cycle of education groups, all centered around relapse prevention for the alcoholic and the addict. So we offer 2 time frames of this program, either in the morning, 9:30 to 12:30, or at night, 6 to 9.
Okay.
Average person stays about 4 to 6 weeks. And again, all the work is centered around trying to put relapse prevention skills, knowledge, insight, support to helping people maintain the longevity of their recovery.
Okay. Now you said the average is 4 to 6 weeks. What's the length of time or the minimum length of time that they have to participate in the program to really benefit from it?
So we ask clients to at least commit to 4 weeks. We find that at least with 4 weeks minimum, we're able to at least put some things in place to help them stay clean and sober, help them maintain their recovery process. Some of our clients do need more time though, because depending upon what they have for resources prior to starting the program will then correlate to how long they should stay for.
Okay.
So we work very closely with insurance companies to make sure that people get the full reimbursement that they deserve to accommodate and build the recovery that they're looking for.
Okay. And now is this like a once a week type of thing? Do they come multiple times a week?
So correct. So the patients do come 3 times a week.
Okay.
Each time they come, it is 3 hours. So again, either in the morning, 9:30 to 12:30, or at night, 6 to 9. Again, it is predominantly group work, although we do have, each client does meet with a case manager once a week for about 20 minutes to a half hour to provide that individualized service.
Okay. Well, this certainly sounds like a great program, and I do have a few more questions about it, but unfortunately, it is time for us to take our last break of today's show. If you're just tuning in, our show today is all about our MORCAP unit, and we are here with Tom, and he is the lead clinician who also oversees our outpatient program for the MORCAP unit. And when we come back, we're going to learn a little bit more about that. So stay tuned. We'll be right back after this short break.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
From all of us at Morton Hospital, thank you to our community for voting for us in the 2021 Best of the Best Community Choice Awards. We're honored to have been voted Best Hospital, Best Audiologist, Best Hearing Aid Center, Best Physical Therapy, and Best Weight Loss Center in the Metro South region. Learn more about our services and quality achievements at mortonhospital.org and follow us on Facebook to stay up to date on what's happening at your award-winning community hospital.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning and welcome back to the final segment of today's Morton in the Morning show. If you're just tuning in, we are talking all about our MORCAP unit today, which is our Level 4 Substance Use Disorder Treatment Unit. And we are here with Tom Rumbell, and we're talking about the outpatient component of that service of MORCAP. So it's an intensive outpatient program, stands for IOP. And before we took our break, we were talking a bit about that program and the group sessions that happen here at the hospital on a weekly basis. I understand that we're also gearing up to soon be able to offer a virtual version of the outpatient program. So
Correct.
How is that going to work?
So virtual IOP would basically mean people will be able to log in from home. So for clients who may have challenges getting back and forth to services due to ride difficulties, maybe lack of license, clients who also may be unsure whether or not they can participate in a group atmosphere due to varying levels of group comfort levels.
Sure.
So we're going to be able to provide that service to really help those clients meet them where they're at.
Okay, well that's great. That's really exciting. Now, what are the other qualifications in order to participate in this program? Do they have to have been a patient in the inpatient program here? Can someone just go right into the outpatient program? How does that work?
Certainly. So we do ask all of our clients that participate with us that they're not going to be in the dangers of withdrawal symptoms. So if somebody's going to have complicated withdrawal symptoms, we do ask that they perhaps consider the value of a detox first. But our clients do not have to come from a detox. They can certainly call from home, or we do also get referrals from other agencies. We do work closely with other doctors, other medical people in the area, as well as other healthcare providers. So we take our referrals from anybody who would like to begin the process of their recovery.
Okay, and I would assume with the program there's a lot of group discussion, a lot of education. What are the types of topics that are discussed during the outpatient program?
So we help our clients understand what an addiction is. We help our clients understand what a recovery might look like. We offer support and guidance around how to utilize environmental resources. We do work with our clients, say for examples around stress management, coping skills. We do offer our clients an understanding of the MAT, medicated assisted treatment, and help them understand the values of all the resources that are at their fingertips.
Okay, that's great. Now, what would you say is your ultimate goal for the patients that go through your program?
To build a lifetime of happiness, to help them close certain parts of their life that they find are uncomfortable, and help them rebuild their lives where they feel there's been some deficits.
Okay. And how do you, what are the tactics or strategies that you use to help people stay on track with their, sobriety or whatever it may be?
So we do it through, again, our education format of going over relapse prevention skills. We also help motivate, encourage. We have peer support groups as well. Clients who, when they come through our program, we help them set up an aftercare plan, which might include Meetings, it might include one-on-one counseling.
Yeah.
We do reach out to family works because we feel the better the family understands the challenges with addictions, then the more supportive they can actually be. So we try and take on wherever the deficits may be in the client's recovery process.
Mm-hmm. Okay. Now, are family members ever encouraged to be part of the program? Is that really just the patient themselves so that they can be separated from outside distractions, or how does that work?
So with our family piece, we do offer a reach out from, we call family members. We go over what an addiction is, what support might look like, and as well as support groups for them. And support groups for them would include the Al-Anon, the Alateen, the Learn to Cope, and Safe Coalition groups.
Okay.
So we do educate our families just as much as we educate our patients.
Okay, yeah, that's really important because I know, recent shows we've also spoken with the behavioral health team, and they talk about how they always have to incorporate the family as well because they're so important, for support, but also for continuing to encourage the patient to stay on track and just to be educated about also how to, interact, what are things that you should or shouldn't say to the patient. So those are the types of things that you often talk about with the family members?
Correct. What separates enabling versus supportive.
Okay.
So we want to make sure our family members can understand addictions just as much as our clients, because agreed, people who have the better success are the ones that can incorporate many attributes and many supportive people.
Okay. All right, and as far as the program goes, if someone has not been an inpatient on the MORCAP unit, but they may qualify for outpatient, do they need to provide a referral? Is this a self-referral type of program?
For most insurance companies, it is self-referral.
Okay.
They can certainly call our number directly. We can help then orchestrate the evaluation appointment to determine the correct level of care. Sometimes we get clients who are just not even sure where to begin.
Right.
So they may call us up and we'll educate them on their options and their choices and assist them into other levels of care, and they may or may not even be our own, but whatever the client's needs best suit.
Okay. Now, aside from running the program, the weekly programs, you said there's a morning session as well as an afternoon session or an evening session.
Correct.
For convenience, obviously. It sounds like the virtual program is going to be great, very convenient for people to be able to participate in the comfort of their own home. So when you're not doing that program, what does a typical day look like for you? Are you meeting with the patients? Are you, screening new potential patients for the program?
Well, as the lead IOP clinician, I have a variety of roles. So I do the groups directly. We also do meet with the clients for an evaluation and to help them determine the correct level of care, so I would take on that role. We also do peer staff groups. I also meet with my administrative team as well as my staff team to kind of go over where we can make our improvements in providing services.
Okay. Well, that's great. In closing, is there, what in general or anything else you want the community to know about what you're offering here?
Yeah, I think it's nice for the community to know that there's another resource in their area. Know there's many resources in their area. Not all resources are the same. So just because you may hear about a particular type of care, sometimes depending upon where that facility is, could vary what that level of care might look like for that particular facility. So, for example, we have our program here of IOP. We limit our group size to only 15 patients.
Okay.
Some other programs sometimes may have larger group sizes. We do drug testing as part of our program.
Yeah.
Some of our local treatment programs don't do any form of drug testing.
Yeah.
So we do, just because we're not all programs are cut to be the same way.
Yeah, yeah.
So what's unique for one program may not be the same for another.
Sure. Now, as far as the limiting the size, what's the rationale for that? Is it more impactful for people if there's a smaller group setting? Maybe they're more likely to open up and share.
Correct. So it's kind of similar to if you were a child and you were learning. Working in a smaller classroom means you might be more comfortable with the learning process, as well as sharing some information that may be delicate. So with smaller group sizes, we can really accommodate people with where they're at, as well as it's big enough where the clients can get support from each other.
Okay. Now you mentioned that you work fairly closely with, some community partners. So what about, partners out there that often may refer patients to our programs here at the hospital?
So there's other local detoxes around that do sometimes refer to us. We do have referrals from DCF workers, probation officers. We see companies refer patients to us. So we were located in Foxborough, Mass. for quite a long time. So now that we're here in Taunton, we're establishing we're enlarging our referral pool from what it already was.
Okay, well, great. And I think the most important thing is patients can self-refer. So
Absolutely.
If someone's out there that's struggling, at least call, right? At least call the department, call MORCAP, see where you might be able to start. You might be qualified for the inpatient, you might be qualified for the outpatient, or our team up there will provide resources, right?
Even outside of our scope.
Okay. Well, great. That's a lot of great information. It sounds like we have a wonderful program. Looking forward to our virtual program, being able to, offer that to our community as well. So thank you so much, Tom, and thanks for all of your great work.
Thank you.
All right, well, great show today. I hope you enjoyed it as well. A huge thank you to Dr. De Lima, Justin, and Tom for being here with us today to talk about this great program that we offer here at the hospital right in our community. And before we are done, I want to make sure I share the phone numbers for if you or anyone you know is looking for some assistance, with substance use disorders. We have our inpatient program, and the phone number for the inpatient program is 508-967-3200. Again, that's 508-967-3200. And then, as Tom mentioned, we have our intensive outpatient program, also known as our IOP. The phone number to reach out to the outpatient program is 508-967-3838. Again, that is 508-967-3838. You can also find information about our MORCAP unit on our website, mortonhospital.org, and it is under MORCAP on our list of services. And again, if you're just tuning in, if you missed today's show, don't worry. We post all of our shows online and then share it to our Facebook page. So if you go to facebook.com/Morton Hospital MA, or just search for Morton Hospital on Facebook, then you can like and follow our page and make sure you don't miss any of our shows. You can listen right at home and also learn about the other great news and updates and events happening here at Morton Hospital by following our Facebook page. So that wraps up our show. We look forward to joining you in the coming weeks with some more great new shows and special guests. We want to thank you all for listening today. And don't forget, we are on every Wednesday at 11:05 a.m. right here on WVBF, your hometown radio station. Thanks for joining us. And from all of us at Morton Hospital, we hope you have a happy and healthy week. Morton Hospital's nationally accredited Center for Weight Control has grown with the addition of Dr. Deepthi De Silva, our new Director of Medical Weight Loss Management. Our center now offers high-quality medical and surgical weight loss options close to home, with medical weight loss appointments now available in Taunton and Middleborough. To learn if you qualify for weight loss surgery or medical weight loss and to schedule a consultation, call our Center for Weight Control at 508-301-2434.